Good morning, everyone. Thank you very much for tuning in. Welcome, good morning. Welcome to all of you who have turned into our event on the role of regions and cities in supporting apprenticeships, upskilling and reskilling in the health sector. So a very topical issue, of course, as we all know, unfortunately, in a way. But nevertheless, welcome again. Very happy that you all tuned in this morning. And I'm really looking forward to an interesting exchange on the role of apprenticeship. We have invited a group of really interesting speakers, practitioners from the regional and the local municipal level. And we hope that their contributions will bring some new insights to you as well and will be useful for your work. So that we make the best use of the time that we have, please let me already get started by just saying very quickly, you are joining us on Facebook and other streaming possibilities. So interaction is sort of somewhat limited, but on the other hand, you also don't need to have to turn off your cameras and mics. There's no interference, hopefully. So really looking forward to also getting your questions through the chat functions. They will be collected by our technical experts and teams and sent to us. We have received already some beforehand, so we hope we can address them. So thank you again, and let's get started. We will start with our first speaker, Ilias Livanos, who is from Cedefop, which probably all of you know stands for the European Center for Development of Vocational Training. Good morning, Ilias. Very happy to have you with us. Ilias is Cedefop expert. He's working in the Department for Skills and the Labor Market and heads the Skills Forecast and the European Skills Index projects. So quite some work, I could imagine, and has been responsible for conceptualizing the quantitative structure of the skills panorama, which some of you might perhaps know. And he's involved in several other Cedefop projects on skills, the mismatch issues, for instance. He is, I'm happy to say, being from an economic institute myself, he's an economist by training with a PhD in employment research from the University of Warwick. And he has already some experience at the university as well as Cedefop. Let me also, just before you get started, Ilias, point out that Cedefop has recently published a very topical briefing note on apprenticeship, a pill for every ill, which of course works very well with the topic that we have today, which is the health sector. So, Ilias, the floor is yours. You have about 10 minutes for the explanations on the skills forecasts and other findings that relate to our topic of today. Here you go.
Thank you so much for the introduction, Sandra. So I do have some slides to share with you. I will be talking about Cedefop skills forecast and in particular the results on the health sector, which is of course the interest of the audience today. So if we can move on to the first slide, please. So I will not say too much about the skills forecast. You can see a few pointers in this slide. Just for the time being, keep in mind that it is a unique database which has been developed by Cedefop and that it offers projections of trends in employment across sectors and occupations for all member states. And typically we look at an horizon of 10 to 15 years. Next slide, please. So a question that may pop up is, why do we need the skills forecast? Well, the knowledge of the future does influence the decisions made today. And if you think about it, getting the skill set right is like the Rubik's Cube. It has multiple facets, so you have to twist it to get it right. So we believe that having some knowledge about how the future labor market will evolve, it's quite important in this aspect. Next slide, please. And of course, what we want to avoid is a situation like the one you see in this picture. Somebody has been has decided to become an astronaut, has been trained as an astronaut, and only realizes that there are no available jobs when he visits his local employment office. If he had knowledge of the future trends, he would perhaps emigrate to another country and pursue his dream there, or to some other occupation that has prospects in his local region, and so on. Next slide, please. Okay, so getting into the skills forecast, I will not talk about the methodology at all, just to let you know that we adopt the most likely to happen scenario. That means that we adopt the official projections of economic activity and of population as they come out from Eurostat, and we transform the projections of economy into projections of employment. And just to say a few things about how may employment in sectors be influenced by some megatrends. Of course, we have aging, which means that in the future there will be less spending on consumer expenditure, and there will be more expenditure of the public sector and the private sector towards health-oriented services, which I guess it's quite interesting for you. And of course, we have technological change. We know that some jobs will be lost and some other jobs will be created in other sectors and occupations. So all this create a restructure of the composition of the GDP, I said before, away from consumption towards more health-oriented services, and so on. So let's say this is the background of the skills forecast without any details. So let's move on, please. Okay, so I will just get into the results that may be interesting for you. So on the right, we see a map that shows the future employment growth. So it's the employment growth of the health sector to 2030. And what we see is that the darker is the color of the map of the country. In the map, the most growing will be the sector. And I have picked just a couple of countries. So we have Romania that will experience a short, an important increase to 2030 in employment, of course. And Lithuania that will experience, if you like, a decline. So just by looking at this, we start trying to understand what is going on in this country. So Romania is a country where typically there is low immigration to other countries when it comes to the health professionals. There is a strong support of the government into producing more doctors. And of course, there is aging, as in most of the European countries. So all of this will create the needs for a growing health sector. On the other hand, Lithuania is quite the opposite, because the government is less dedicated into helping this sector in terms of employment. There is a very strong immigration towards other countries. But at the same time, Lithuania is facing one of the most important aging problems in Europe. So we see that in the future, they may actually face difficulties in trying to maintain the healthcare system, just looking at the aggregate level, of course. If we can move on, please. Okay, so this is just an overview of the health sector to 2030. What maybe it is worth keeping in mind here is that it is a growing sector. So in 2030, it will have grown 10% in terms of employment again. Based on what it is today, of course. And on the right hand, we see what would be the composition, the breakdown with regards to the level of education. Of course, as no surprise comes the fact that the health sector is mostly employing highly skilled, highly qualified individuals. Of course, we have all the credentials needed to become a doctor, a nurse, and this explains this composition. If we can move on, please. Okay, so now getting into the occupational breakdown, we see that there are mainly three occupational groups that consist of 60% of the health sector. So we have service workers, which is mainly the care workers, of course. We have health professionals like doctors, and we have health associate professionals, which are nurses, physiotherapists, and so forth and so on. And if you're wondering what is the remaining 40, it is all the professionals, all the workers that they have to contribute to the sector, such as cleaners, sales workers, and this and that. And on the right hand, you see what is the breakdown with regards to the skill level based on the occupation. What is worth mentioning here is that composition in terms of occupation, it is actually quite stable, and it will remain stable over the years. And this could be explained by the fact that technology is not as important as is in other sectors, and maybe all these robotics, if you like, they're in the first steps of their development, or at least they're not there yet to be fully implemented. So that means that there will not be as many jobs lost as there will be in other sectors or jobs created. So the composition will mostly remain the same, but maybe one thing that we should keep in mind that it is a sector that compared to others, it is actually aging faster. And this could be linked to the fact that the baby boomers, they're actually now phasing out their career. They're getting close to a retirement, and this will actually create many needs for replacements in the years to come. And the next slide, please. Okay, so this is a slide that shows what will be the share of employment in the health sector by country. So on the left, we see some countries that they have, they're mostly countries of the north. They're well-established systems, they're quite generous welfare systems, and they are employing and they will be employing a significant amount of workers. And at the same time, maybe because of these reasons, there are countries that are not facing problems with aging as much as do the countries on the right, where not only they face severe problems with aging, for example, Bulgaria, but they also employ a very small portion of the workforce in that sector, which could be a signal about what it may happen. And in the bottom, you also see the share of the European Union, so you can start comparing. So these are the main trends as they come out of the skills forecast. I would like to say here that these are just numbers, and they need to be coupled with expert knowledge and expertise about what is happening in the sector. So I think this could serve as a backbone of your analysis, and definitely you know much more about your sector than I do. So if we can move to this final slide of my presentation, which is just a big thank you. I can tell you that all the data, they're available online. You can visualize them, you can download them, you can do mainly anything you want with this data set. If you have any questions, I'll be more than happy to answer them now. And of course, you can see my email there. I'm very approachable, so feel free to drop me a line if you need any details about how to use the data, where to find them, and so on. So I will stop now since time is precious in the online environment. I thank you so much for your attention and happy to answer any questions you may have. Thank you.
Thank you, Elias. Very interesting overview. And I think indeed a skills forecast and sort of a preparation on what will be needed in the future is very, very key also for the labor markets that we are experiencing today. So thank you very much for those insights. And I think it's really key to also follow the work that you do and take away, some of the insights into the daily work of our audience and of the people joining today. Unfortunately, we do not have a lot of time for questions and answers. So I would like to just ask the audience to get in touch with you via Cedefop and maybe have specific questions and insights directed to you. Just for me to thank you very much for this really interesting overview. And also to just make us aware of the source of knowledge that you are presenting, and that maybe doesn't need to be repeated elsewhere often, but that there's actually a lot of information that is very, very important for the way that we train our younger generations. So Elias, with that, thank you very, very much. And I will already move on to the next bit of our program, which I'm really looking forward to as well, because it's what I call the voices from the ground. So we have two practitioners that actually are very active in the health sector. And I will leave it to Mr. Ricardo Lamadrid, the Director of the Technology and Advanced Training of the Vice Ministry of Vocational Education and Training of the Basque Country. So Ricardo, very welcome, very warm welcome to you, and the floor is yours to also introduce your compatriots.
Okay, thank you so much, Sandra. Hello to everybody and welcome of course, welcome to this workshop. Now, I will try to briefly explain what we have done and what we are doing to support the health sector here in the Basque Country. Of course, the Basque vet system is collaborating closely with the Basque Health Department. In the same strategy, with the aim to improve some or several products. For example, we designed masks with protective screens for health workers, and we started producing them in Technica, in our research and innovation center in vet, and also in 55 vet centers. Technica and vet centers work also designing a ventilator prototype with using 3D printing. Also, some breathing equipment were repaired in the Basque vet centers. In addition, three different surgical mask prototypes were designed by Technica. We started researching and we designed them, and nowadays a Basque company is producing them. Of course, these surgical masks are certificated by an official laboratory. Because of this mask production, 45 vet students are working in this company. With this kind of real challenges, our teachers and also our students get more motivated and more committed in their day-by-day work, and in our opinion, is the best way to develop the skills that are needed nowadays here in the Basque Country. But I think that the best example is giving the floor to the real protagonists and let them tell it live. We have here Leire Herboso, is a vet teacher, and also Leire Cortabarria, a vet student, and both are involved in the surgical mask initiative. So, Leire, the floor is yours.
Thank you, Ricard. So, hi, as Ricard has said, I am a vet teacher here in Technica. Here, really, my work is not teaching basic students. What I do here, and my co-workers do too, is to form other vet teachers, especially to give them laboratory skills, so they can apply this knowledge then in their classes, and also to some of them to renew their previous knowledge as the science go on and teachers need to renew everything. We have also several projects here, but last year, as this pandemic situation started, as Ricard has said, the Basque government asked to the vet centers if they were able to give a solution to the situation, especially to the shortage of protective equipment for the sanitary workers. So in Technica, what we did in the project I worked at that time, we started researching in new face masks. Our idea was to produce face masks using materials from here, materials which were sustainable and biodegradable. But we faced several problems finding those materials because most of the materials used for the industry are made in Asia. But at the end, we were able to collaborate with the company from the Basque Country that they create different materials with paper, and we use their material to try to make a face mask. For the project, what we did is to analyze face masks that were already being used by hospital workers, and we break them. We analyze the 3 layers of the mask. We realized that the inner and outer layer were quite similar, and then there is the 3rd layer in the middle, the filter. And we looked to the fibers, the material they were done, how the fibers were bound together. Also to the space produced when you do the material, there is a different kind of spaces between the fibers. And after looking to that is when we start characterizing materials from the company of the Basque Country to find the best one that has the similar characteristics to this face mask. After doing that, we start collaborating with other vet centers, and we design different face mask prototypes. Different students work on that project, and then the health department of the Basque Country try those prototypes, and they choose the best one, the ones that are better for the sanitary workers. And after doing that, what we did is send those face masks to an accredited laboratory, so they can pass the tests that are needed to be homologated as surgical face mask. Those tests are the breathability, the bacterial filtration efficiency, and also the resistance to blood splash. And we passed those tests, and we were able to patent one surgical face mask that is being used actually. And as Ricard has said, it's being produced in one company in the Basque Country, and it has employed a lot of students from the vet centers. Apart from that, we face another problem during our trying to find these face masks, as there was during the pandemic only one company at the level of the state which was able to do the test required to pass the European standards. And this company has so much work that they become a bottleneck to all the other companies from Spain that were trying to make new face masks. So every time we send to them a sample, they will spend like 2-3 months to give us the results. And at that time, we couldn't improve our mask if they need to be improved. So what Technica did last year too is to buy the equipment required for doing this test, the bacterial filtration efficiency, the breathability, and the blood penetration test. And several teachers has learned how to do those tests. And at this point, we are able to try different face masks that are being produced, but we are still not accredited. So for us, it's like a first validation of the mask. And if we pass the test, then we are able to send them to the accredited companies. And apart from that, we have another project in Technica. We are trying to homologate the face mask, transparent face masks, to allow people with hearing problems to read the lips of the people they are speaking with. And also we have the objective of creating completely biodegradable face masks, and also gloves and surgical caps and lab coats, to reduce the impact that all this protective equipment is having at the moment in the environment. And with this, I pass to Leire, because she's a student who has been working in this project, and she's going to give you her knowledge.
Hi, I'm a second year student of pattern making and sewing in AEG, Escuela de Innovación Profesional in San Sebastián. A few days after the lockdown in Spain, one of my teachers told me that they were going to start sewing face masks for the school, in the school for the health employees, and I was very glad to volunteer myself. But the time that I started working, they already set up a sewing workshop, keeping in mind all the safety issues and the social distance. There were teachers from all the departments, some sewing, other cutting the filter, making the layers, inserting the nose wire, or getting rid of the thread, or delivering the output. Almost everyone who had a business related to fashion in San Sebastián or nearby, they volunteered themselves to make face masks, and in their own workshops, we provide them with the fabric and collect their face masks, and then give the final touches at the school. At the beginning, we sew with face masks. Everything that was sewed was delivered immediately. And by the end of my first week there, we make some changes in the way we produce, such as distributing the work between cutters, sewers, quality control, and delivery. For a few weeks, we kept changing the design and the way the pleats were ironed so they look even, and how the elastic were set in the face masks. We moved from the back of the face mask to the front, like they look now. It was a little bit stressful, but we found a pace. We improved our production. We were able to send every face mask on Friday. Moreover, as things were going on, Technica offered us to design face masks for hearing impaired people. We needed to make a face mask that kept all lips visible, but was also safe. We also were offered to prototype surgeon gowns and caps and shoe covers. Everything was designed and sewed with a sustainable fabric, which was provided by Technica and was water dispersible. It was a very satisfying experience, and I felt that was, at that time, was the best way that I could help and to know how things were in real life. Thank you.
Yeah, thank you to Lehre and Lehre. It wasn't a prerequisite that you are called Lehre to be a practitioner here today, but yes, for these insights. And I think it's really interesting to see how different actors came together to deal with this situation and how the different sectors sort of cross-fertilized and sort of influenced each other to improve the product and to improve the situation overall. So thank you to the two of you for sharing your insights and your views. Again, unfortunately, we do not have enough time to pose a lot of questions to you. So let me just thank you. And I think I speak for the audience also. It's really interesting to get this information from people who have been really on the ground, have been really involved in improving the situation in real life and not just by talking as we tend to do sometimes. So thank you both very much. And I send you off to continue working with the community there. So I guess we should have added to the upskilling and reskilling in the title of our workshop also some kind of cross-skilling where indeed you can take what you learned from one sector into your work in another one. But now I have the pleasure to announce our panel. We have a panel debate now with really interesting speakers representing the regional and the municipal level, as you can see here now on the slides. It's quite an interesting cast with lots of different insights and information from various bits of the sector. And let's get started for this about 50 minutes that we have before you can also then ask questions online, which we then put to the speakers. We get started with our first speaker of today on the panel. It's Maria Pascual Garcia, the head of the unit of international projects for VET and the Regional Ministry of Education of the government of Catalonia. So Maria, thank you very much for joining us. And
thanks for the invitation.
Maybe I should say, before I give the floor to you, we did ask sort of 3 questions, or sets of questions to all the speakers. One was it's also a bit a reflection of what has reached us beforehand in the Q&A. We were asking our professionals here how the health sector is going to be attractive for job seekers and who is responsible for making it so. We also asked them how comprehensive the training programs are and who is designing them in their sort of regions, and also how COVID obviously has changed things and what we can take away. So those are the very broad questions that we have given our speakers, and we've set them the more or less impossible task of giving 5-minute first insights and feedbacks, but then we will go around and hopefully cover most of the topics. So having said that, now the floor is yours, Maria.
Thank you so much, Sandra. So, well, yes, the COVID has brought us very impressive, let's say, challenges, and it has got good and bad effects when it comes to reorganizing educational paths in a way. As you said, I come from the Regional Ministry of Education from the government of Catalonia, and we are in charge of reorganizing the official curricular set up in official vocational curricula set up in Madrid. We have nearly half 50% of power to adapt them to our needs, to the regional needs. That's very important. And how do we work? We really believe in innovation. How do we organize our actions? We mainly work in networks, in networks on innovation, for example, mobility and international cooperation, counseling, and the apprenticeship system. So all the vocational schools and centers in Catalonia are distributed according to their needs. So they are quite autonomous among those networks, and then they work on specific projects, right? So those networks really are all the time up to date and updating their training programs to fulfill our vocational schools' needs. And then what do they do? So depending on the situation, they adapt their programs, as I said. For example, the Innovation Network works with training center stakeholders and companies on developing innovation projects from the schools. What are the needs of the companies? So the companies say to the school, I really need this and that. And then, because the vocational schools are hubs of innovation, are hubs of knowledge. We have, let's say, teachers who are really willing on updating their professional skills and professional and technical competences and transferring those to the students. So some years ago, we discovered that we could, let's say, make make stronger the links to the companies, especially the links with the companies in the vocational schools, let's say, area of influence. Then in all the vocational sectors, so when something like the pandemic arrives or takes place, then the needs of the companies change. And then this is, let's say, sort of transferred to the vocational schools, and then the vocational schools start working on that. So that's real. That means that the world of labor and the world of education are working more and more and more, let's say, together and closer to fulfill everyone's needs, because we really want to let's say, train the students who will be working in those companies, and we want the companies to accept our students because they really make up and they live up to their expectations, let's say, and what the labor market is offering to them, because the labor market is changing. So we cannot have a static educational pathways which cannot be adapted constantly to these. Obviously, some core elements won't change, but we want vocational education to be flexible in that sense. So the Innovation Network work a lot in the reskilling, upskilling of students, as well as obviously the mobility, but the mobility network was quite affected because of the pandemic. The students could not go abroad. And also we are really working on the dual system from many years ago. So most of our vocational qualifications are in the dual system. The dual system at first was affected due to the pandemic, because students at first had to stop working in hospitals. But we discovered other ways, and as at the Ministry of Education, we change, let's say, we adapt the laws, and we propose our vocational students to be able to transfer and work on the competencies they would have worked in the work placements, in the time they spend in hospitals and in workplaces, in a project assessed, evaluated by the company tutor, in this case, someone at the hospital and in the training center. So students could still be working, let's say, in a real situation with a real tutor at the company and at the school. That was another measure which was taken back then. And as my colleagues were just saying, the training centers, as I said, they are really hubs of innovation and knowledge. They started also working with hospitals, providing help when it comes to providing material, providing assessment, even providing, as I said, in the distance, so some work with their students and the teachers. There are many experiences from our training centers in that sense. And as I said, this is us. Our core flexibility measure is working with networks, which has got an initial program for the whole academic year, which is being adapted depending on the needs created by stakeholders involved in each, let's say, vocational qualification and the needs of the society in general. I hope I answered your questions more or less, and I'm willing to reply to the others and answer to other questions.
No, absolutely, very interesting, and I think it's very key to indeed have this network approach. Also, the dual system, of course, has huge benefits, and as you have been describing, the participation of stakeholders and to really have everyone contributing to making the training as useful and as praxis oriented as possible, and to really have a flexible and pragmatic approach on things is very key. There are already some questions to you, but I will first let the others have their say, and then I will come to you with some of the questions that we have received. So thank you very much. And we move on to the next speaker. We move from the south of Europe to the north of Europe to Birgitta Zacharias. She is the regional councillor in and a member of the Dalarna Regional Board in Sweden, and she's also a member of the Committee of Regions. So she's very well aware, I guess, of all the different developments in Europe. But also, obviously, you are very much involved in the sector in your home region. So, Birgitta, we have the same questions to you, but I guess also one of the issues is how do we actually get interest in apprenticeships? I'm from Germany originally, so I know that there's always this debate about rather go to university or maybe learn something like practical. So I don't know if the situation in Sweden is different to that, but I give you the floor now to explain a little bit on how the whole situation is sort of panning out at the moment in your region.
For the word. First, I want to tell you something that is really important, and that is out of the 27 member states in the EU, it's 19 that are responsible for healthcare on regional level. So it is in Spain and also in Sweden. We are the ones who are responsible for healthcare. So I'm a politician, so we are employers, and of course, we are in need of having people working for us so we can give our inhabitants good care. And I think here we must look on lifelong learning. We have many elderly who wants to become assistant nurses. Assistant nurses are really important, especially now when we know that there will be a large number of elderly. So we have adult education, and 60% of the workers have gone through this, because youngsters sometimes are not so interested, but later on they are interested in these businesses. So assistant nursing is on local level where you get your education. And then we have nursing, and that is of course at the universities. And there it's responsible for the politicians to open up, to have places. In Sweden, not everyone can study. You have to have a certain qualification, a certain but we have increased the places to educate yourself to nurse. And of course, it's very, very important for us to be attractive. So people want to be nurses. And luckily, we can say that during the COVID crisis, more people want to be nurses. You could think it should be the opposite because you heard they work hard and so on, but no. They now is more numbers seeking to become nurses. This is a plus due to COVID. But to have quality, it's very important, and we heard this before, to have networks. And when you are in the city and have pre-courses, we have a college where we try to have more internships, so they also get the practical job. It's not just reading, you have to do the practical. So we try to, in this frame, we try to use that the students can be internship. Internship is really important, and apprenticeship is, of course, of great importance. This apprenticeship is organized in networks, and we try to increase the quality and the quantity of apprenticeships, and exchanging experience among and collaborating in general on all levels, national, regional, and local level. This is very multi-level governance, actually, to increase quality. Due to COVID, you had to be flexible. So what we did from the regional side was that nurses that didn't have lost flight attendants who have lost their jobs, we re-educated them, so they were assistant nurses. So you have to be flexible in a crisis. And many were interested, and because they are good in service and caring, so this was very positive for us. And also, we have to make it's better to have an internship, but it's very, as we heard before, internship is very difficult when we are working in crisis situations. So that when the COVID-19 is away, this is something we really have to work on, the internship, that they come back again to have practice. Finally, I will just say that we as employers, we are happy that the number of people that are interested to work in the health business is increasing. So that's very nice to look for the future, that it will be a light future for the health workers in the future. Thank you.
Thank you, Brigitte. Very, very interesting insights. And you have decades of experience in this sector. So I'm sure there will be some questions later on that will sort of test you on your experience and your insights on how this cooperation is working and how you can be flexible. I really find it very interesting that you say that this lifelong learning has such an impact on the job market at the moment, and that it's mostly adults that show interest. So I'm also very interested in following up on this point. But first, we move on to our next speaker, and this is another voice also from the very practical, from the sector. We have with us now as the representative from a German organization, Professor Dr. Karin Reiber. She's a professor for nursing education at the Esslingen University of Applied Sciences in Germany. She actually has a background as a nurse. She has trained as a nurse, and then she has moved on, got a university degree, and now holds a very interesting and influential position also at the university. So, Karin Reiber, thank you very much for joining us here and also for sharing with us your insights from sort of the practical experience, but also now from sort of the, let's say, science point of view on how the training for nursing is going and what is necessary for getting the right skills sort of deployed and people into the sector. Jill, the floor is yours.
Thank you very much for this introduction. So first of all, I want to start with the situation we've got in Germany, but I think not only in Germany, it's in whole Europe, the staff shortage, especially in nursing. So the first question we have to put on this subject is, what is the attractiveness for job seekers? As Birgitta said before, that there are several, especially women, I guess, that are not really young, that are interested to get an apprenticeship as nursing assistant. And so we have to ask about the attractiveness. We have to say that there is still the main motivation are intrinsic factors. For example, to do a meaningful professional activity or to help others. These are still very, very famous intrinsic factors. And the attractiveness, we have to say, depends on the image of the profession. And there is a great difference between the different health professionals. For example, the medicine has got a very high image and nursing not so far. So the image of the profession is something we have to work on to get more employers and more apprentices into the system. So for sure, the wage is a main factor. And then that depends on the job, on the health sector. It's different between, for example, nursing or therapists and medicine. And these wages are the result, let's say, of the employer and collective bargaining agreements. So it's a little bit a difficult way to influence that. We have also to talk about the working time because it's rather unattractive. There are often shifts and weekend work, especially in nursing. But on the other hand, this could be attractive for example, for employees in part-time, for example, women with little children who have their partner at home during the weekend or the evening. Yeah, but we also have to admit that employees in the health sector report very hard working conditions. Like, for example, the worker in construction industry. And the attractiveness of jobs in nursing is very affected by characteristics as, for example, atmosphere in the team, or especially the time for patients. That could be even more important than the wage. So, who is responsible for the healthcare sector and for its attractiveness? Let's say in this last point I mentioned, it is the company that could do a lot to influence on attractiveness. For example, we see that in magnet hospitals, the leadership, the working time models, career opportunities, which are offered to nurses or to health professionals, for sure the wage and the health management. So the training programs, there is a great change just now. The training programs differ depending on the profession. On the one hand, we've got the academic education, and on the other hand, the vocational training. But it's different, for example, compared to that what Birgitta said in advance. The vocational training, even for example, for the nurses, not nursing assistants, but for nurses, is in a vocational training. And there is, besides the vocational training, just now, since 2020, there is a possibility to study, to get an academic education, but there are the both ways. And the academic way should be about 10% of the amount, and vocational training still remains the main part for apprenticeship of nurses. So it is in a dual vocational, not in a dual system, I have to admit, but it's dual organized, let's say, with these two places of learning, vocational school and a training company. And regarding to the EQR, it is classified at level 4. It is required to be classified at level 5 based on competencies. So there's a little bit unsure. We have a great variety about regulatory and curricular structures of training and further education. For example, healthcare nursing schools hold a special position beyond the vocational training system, even if they are in a dual structure organized. The European connectivity is not really given, and responsible for the curricular are the respective schools and institutions, but following the law, the professional law. And in contrast to general education schools or vocational schools, the teacher qualification is quite different. So I want, for the last, I guess, 1 or 2 minutes, talk to the COVID-19 pandemic situation and the changes about that. Well, it's obviously that there is a everyday work change, because a withdrawal from face-to-face work is not possible in a healthcare profession. As a consequence, the digitization push remains cautious. Due to the contact restrictions, the healthcare professionals are often the only contact persons for people in need of care, in hospitals, at home, or in homes for elderly people. So they have a lot of duties to be about the social impact for the patients. The workload increases, and in health professions, those who have tested positive for corona were allowed to work. Physical and mental stress increases, and the managers are burdened by the concern, on the one hand, for the people in need, and on the other hand for their employees. For the training activities, the impact was that they changed from in the perspective of teaching. They have to change. They have to switch suddenly to virtual teaching and e-learning activities, which they didn't at all before, I have to say. And from the perspective of the trainees, the placement, as we heard, were reduced, the amount of practical instructions decreased. So we have a higher output dropout rate in training that we could really mention. Even if there are more to come in, that's the same fact as Birgitta said. So the lessons learned regarding the professional nursing, the mix of qualification in elderly care has to be adjusted, between the assistants on the one hand and the nurses on the other hand, and in future with them on the academic level. Then the responsibilities of professional nurses has to be expanded. That's a very important point. The wages have to be adjusted. The digitization must be expanded. And the burdens of the trainees as learners must be taken into account. They are not little helpers of the qualified staff, as they were a little bit now during the very acute phase of the COVID-19, because the work increases, so they were used as little helpers, and they hadn't got the opportunity to be really well instructed in practice. So thank you very much.
Thank you, Karin. That was very interesting. I think that you really highlighted all what was wrong or is wrong, or becomes sort of very obviously wrong in the light of the crisis at the moment. As you say, the higher workload, and then of course linked to much more physical and mental stress, the sort of the burden that people feel when they are the only contact persons for somebody who suffers. So I think it really shows that there's a lot of pressure on those in the sector currently working there and doing their best. And I think maybe after this event, we all should sort of go out and perhaps help or sort of show our appreciation to those that are doing it. I know it's been happening also previously, but I think it continues and it's not getting much better. But thank you so much for your insights already. Again, I have a couple of questions already on my screen, but I will come back to you later with them, because now we move on to the final panelist on our agenda. And she actually comes from a bit of a different angle. Romy Carrier, she's from Luxembourg, where she is a councillor of the municipality of Clairvaux, and she's also a member of the Committee of the Regions. But she is actually not really from the health field. Her background is as a civil engineer. And she has her experience in the sort of teaching area more, working with young people, teaching technical courses, helping young people to find internships, etc. So it's a sort of a complementary view now. She has been the rapporteur of the Committee of Region on the youth employment support. So I guess for you, it's really also the situation of how is the employment situation, the training situation for young people in this sector at the moment. What are the things that you in your role see as the most sort of drastic and most important to address now. Romy, the floor is yours.
Thank you very much, Sandra. Thank you very much, all who are listening now. The health sector workers play a fundamental role in our societies. The COVID-19 pandemic highlighted the needs for sufficient and well-trained staff. As the pandemic progressed, healthcare staff and all essential workers were pushed to their limits in spite of citizens' effort to contain spreading of the virus. My heartfelt gratitude goes here towards all those who kept our communities running, putting their own health at risk. The pandemic has presented politicians and society with the challenge of making the care professions more attractive. We need a graduated training system with different levels of competence and training content, which enable as many people as possible to access specific and practical training. We also need transitions between the individual training courses, bridges between the educational world and the labor market. We're also bearing in mind lifelong learning and the opportunity which can enable further training and better working and living perspectives. Such bridges could also help to ensure that all young people interested in care have access to tailored training, which matches their potential and aspirations, giving them a clear life purpose. It could also have positive effects on school dropout. Nursing education in Luxembourg, for example, has currently only 2 levels, the nursing assistant and the nurse. The training of the nurse assistant can be started after the 9th grade in secondary education. It lasts 3 years. And the training of a nurse can be started at the 11th grade of secondary education. It lasts 4 years, of which 2 can be completed in secondary education and 2 in higher education. Midwifery training, on the other hand, requires 3 years of training at university levels. It's equivalent to 180 ECTS. And is nevertheless also completed with a BTS diploma. The growing demand on the profession of nursing require the training of more complex competencies. The training becomes more difficult, even too difficult for many students who have the entry profile of grade 11. A change from the nurse to the nursing assistant is feasible, but there is a big gap between the 2 diplomas. There is no intermediate training in Luxembourg. This could be the technical training, which should be introduced urgently. We also need a university-based nursing education with the aim of integrating science more strongly into praxis. In Luxembourg, nursing training ends with the BTS, Bac Technique Supérieur, which is equivalent to the secondary degree, which is an additional 2 years of higher education. But these are not sufficient for a bachelor's degree. An additional year of training could significantly improve the chances of advancement in the nursing professions. New paths could be taken so that public health system could increasingly draw on the skills of these professionals. As an example, I would like to mention the area of care of chronically ill patients, where graduates could make a significant contribution to improving therapeutic provision. The EU directive on the recognition of professions within the EU from 2005 and its amendments from 2013 allows for mobility of EU citizens. These benefits could be extended to our other levels of nursing education and thereby increase the attractiveness and achieve more harmonized curricula and therefore higher standards in these trainings. However, the pandemic has also exposed weaknesses in this directive. For example, the clinical training of nurses proved to be difficult, as the entire part of the clinical training must take place in direct contact with people and may not be replaced even partially by simulations and skills labs. Currently, according to the EU directive, the training to become a nurse has to be full-time, which hinders the possibility to explore different career paths unless one would guarantee continued payments of wages during the training. Young people should be given improved opportunities for training, further education and mobility. But also experienced career changers should be given, after retraining, the opportunity in the nursing sector to continue their education up to the highest educational level on a part-time basis. Thank you for your attention.
Thank you, Romy. Very interesting views there as well. And I think it's also one of the questions that was actually already in the chat on what are the different education paths throughout Europe for health professionals. I think you've highlighted the situation in Luxembourg, that there is indeed a bit of a mismatch between early possibilities, and then there's for a while not really sort of an area where people can become care workers, and then you have the higher education where then you need a lot of education again. I wanted to, given that your background is in engineering, I wanted to put a question to you that has reached us. It is a bit different to what we've been discussing so far. And the question is, in what way the use of robots in the health sector will affect apprenticeship schemes? Have you been discussing this in any way? How robots that we hear, in Japan are being used a lot, etc. Has this been in any way part of the discussions that you're having?
Not yet, no. I can ask my contacts, but in this way we had no discussion yet, because all the people are very interested in how to manage all the problems with the pandemic, and the robots are not available at this moment. So there are certainly other priorities at this moment, but this is certainly a subject that should be discussed.
Great. So then I would like to ask the technical support to get all the speakers sort of visible, so that we can have a bit of exchange on the questions that have reached us. So there you are. Very nice gender balanced panel, I must say. But yeah, we balance off all the other events where only male speakers are on the panel, so that works fine. So let me maybe get started with a question to Maria. That goes very specifically to the situation in Catalonia, and given that you are already that you have over 10 years of experience in managing different projects, etc. The question is, what are the policies for the inclusion of internships in health adopted by the government of Catalonia? I assume this is a very pertinent discussion at the moment in Catalonia.
Well, not really, because we have quite well organized, and they have to go through the same process as others. So we have a software where all the work placements are being recorded, and where all the companies which host students are being uploaded as well, and they go through a quality process as the other companies, and one day they have been received an okay from us. They are in our system, and then the students can start making placements in those. That happens the same in companies abroad. We are really into promoting the international dual system. We've been piloting some experiences doing the dual, carrying out the dual stay in foreign countries, and it's been a success. There are some things that we have to still work on both sides. In fact, this summer we're having a couple of webinars on that. I hope you will receive our invitation. And then the companies follow the same process. They've been uploaded on that software, and then that software is accessible by the company tutor, the school tutor, and the student itself, and all the activities and competencies gained are regarded there, as well as the evaluation. I don't know if I answered your question. I hope so.
I think so. It sounds like there is a process in place and it's possible. Then maybe I move to another question. Maybe I can put this to you, Birgitta. It's about the sort of how the regional and local authorities are helping in delivering the training and upskilling. So, and also perhaps in the current situation, have you? We've heard from Maria that they have been very flexible and very pragmatic. Is that something that also happens in Sweden? Has there been a lot of flexibility in the current situation?
Of course, in the current situation with the pandemic, digitization is really important. And I would like to add something about robots. I think this is a digitalization. In our cities, in elderly homes, we have a machine where you can walk in and take a shower. And the elderly really like that because then they can take a shower every day. If you are dependent on assistant, then you can just do it maybe once a week. But here you are autonomous when it comes to taking a shower. And I'm sure this will happen in the future. It sounds so dramatic with robots, but it's not. And smart homes. We are developing this all over, that we have smart homes, we have switch off the lights and the TV and so on. And digitalization is actually a democratic thing that we have to use it, and we have to learn about more digitalization. And this has been the best part, I think, if we should think positive about the pandemic, is that now we are more used to use the digital techniques, and this has also, of course, been very important when it comes to education now between the city and the regional level, that we still talk to each other and so on. But as Karin said, it has been hard with the internship, because you cannot go to working places where they work with COVID. So this is, of course, a problem. And also, so that I stopped there.
Great, thank you. I think I can very much understand the need for, or the sort of the feel of people that would like to do stuff unassisted, as you say, with a shower, etc. So I guess indeed there is going to be some development. Maybe I can put this to you, Karin, as well. How is this technological bit going to influence the job, really, the profession of a nurse or of somebody in the care sector? So one of the questions that maybe also links to this is how you see the development of the practical training for students in post-secondary health schools, and how this is going to perhaps change. Will there be more modules? Will that sort of become a bit more flexible? So the floor is yours on this.
Thank you. Yet for the first question, I think it's in Germany, like as Birgitta said, that we are still a little bit figure out what could be the support of digital tools, or even digital and technical tools. There is a great we did a lot on, for example, the electronic paper of the patient, all that. But there is not still yet not enough that we could use really technical supporting systems as the automatic shower, for example, or even robots. It's not at all used in Germany only in, let's say, in a investigation context. Yeah, that there is that there are some scientists to investigate in practice with them technical, digital and technical supporting tools. But in the main, it's not really drawn out, let's say. So I think that could be a great opportunity to have a little bit more help from this technical point of view, because that could be an attractiveness factor for the employee seekers, because the work wouldn't be still so hard in a physical sense if you could get this help and this technical assistance. Yeah.
Yeah, I think that's a very good argument that this will indeed influence also maybe the kind of people who can do this caring job. And as Brigitte has mentioned, that there is quite a large interest among the elderly to actually become assistants. So that could indeed be a positive way forward. I would have one other question to Maria. There has been one question in the chat. Since in some countries more than others, and unfortunately Spain is one of them, there are many people currently unemployed. Do you see that there is a push into the health sector? Is that a possibility to reskill them into the jobs for the healthcare? Is this happening?
Yes, definitely. Because especially due to the pandemic, it's been an increase of the demand of health workers, like those helping caring patients, diagnostic tests, etc. So all the health qualifications have been highly requested lately. And obviously, since some years ago, we've got a problem now. I don't know if you heard about from the European Union, the micro-credentials. So we had a sort of program similar to that one, because some years ago, the central government, for example, decided to regulate those professions from the workers in elderly homes. So we found that there were lots of people working in the health sector who didn't have any qualification, but did have the technical to be working there. So once the vocational qualification was created, we compare it with, obviously we always do, with the companies in the sector, with trade unions. In order, we work together on the qualification, and we identify the professional qualifications. So those who were already working could go through an evaluation process through a jury who would decide what competencies should still be studied and trained in a vocational school, and some others who have already been acquired by the workers. And the workers had the possibility, I think that was in 2 years, to finish those, let's say, more theoretical qualifications at the vocational school, as well as being working at the same time. Because it's the fear that some years ago existed on that young men working in a workshop and learning from the tutor. And what about that person didn't have any qualification at all, but maybe he or she was a really good mechanic or engineer. And should we unemploy those people? Not at all. And especially when there was a high demand of that qualification. And in elderly homes, we needed a lot of cares. So we upskilled and reskilled that people, and they could prove they had been working. They had that was qualified, a program, get your qualification, and they had a tutor at the company, a tutor at the school, And they said, okay, these qualifications have already been acquired because you've been working in this company for 10 years, 3 years, 4 years. And you need, for example, now, because as I said, all the qualifications are constantly being renewed, upskilled. So you need to acquire this, and you have this time to do that. And as I said, as we try to have a very flexible vocational education, the vocational school adapted as much as it could to the worker's timetable and needs. And for example, he or she could just enroll on different subjects and part-time, so they in some time they could acquire the qualification. And the program is still on.
Okay. Romy, maybe I can ask you this also, because I mean, Luxembourg is not the largest country in the EU, but so my question really is, what Maria mentioned about changes, the flexibility of the curricula, etc. Is that something? How long does that take, for instance, in Luxembourg, to introduce changes, to have new sort of skills as part of the curricula? Is that something that goes quickly, or how would you actually go about it? Do you exchange with the other sort of countries around you on what are the current demands? And then again, how fast would that go? And I'm picking on Luxembourg because I'm sort of hoping in a smaller country it might go faster, but I don't know.
Yes, one could think that if the country is small, then the ways should be smaller and quicker. Everything should be quicker. But in Luxembourg, we have all VET educational levels under the authority of the ministry. So they have all the same time to achieve their over all sectors to achieve their diploma. And this is a bit for us a problem, that if we have a changing in the curricula, in the changing, not the smallest, I would say, but if we have a big change in the curricula, and if we have reforms, we have a reform over all sectors. And if you have to reform all sectors, you have to be you need time to achieve this activity. But what is very difficult for us is that if you try to make the bakery and the nurse assistant and the worker in the civil engineering domain in one educational frame, it is very difficult because for the technical engineers, technicians for the civil engineer domain, perhaps they have to make a project of a house construction. Doing the baker has to make a bread. So if you have to make an assignment, you have on the one hand an exercise who is achieved in 4 hours or 6 hours, and on the other hand, building a house, planning a house from the bottom to the top, it is an exercise over 3 years. So this is the thing that makes for us the changing of curriculums difficult. But we also learned in times of crisis, and the last crisis about 2009, the financial crisis, was taken in account to change VIT. So we offered since then 3 different educational paths in the nursing assistance. We have the initial training, which lasts 3 years. We have the training that can be done as a further education alongside the job in the care sector. And it is for 1 day of school per week during 3 years. And then the second chance training, which was implemented in 2009, because we have many people who lost their jobs, and even elder people wanted to change to work in the care sector. With adults, they were allowed to take if they have been working in the labor market for at least 1 year, and this educational path was 2 days of school per week for 3 years. So we can say that also in Luxembourg, the crisis make things going faster. So I think that we have to take the opportunity of this crisis to make things change and to make the VET educational parts more attractive, more accessible for many people.
Thank you. And I think we still have Elias from Cedefop with us, who I'd like to bring to the panel as well for one final question, which I would put to him in a second. But before that, Birgitta, because you've been such a long time already involved in the healthcare system in Sweden. What is it that you would say, what is maybe the top 3 things that you've been pushing for, let's say, for the last 10 years, and which all of a sudden are becoming possible because of COVID and because of the crisis? Is there something that you can pinpoint where you can say, well, as bad as this whole thing is, at least there is some change finally happening?
Indeed. And I already pointed out the matureness when it comes to digitalization. I really think that artificial intelligence also will help us much more in the future. And I think that can be very interesting for youngsters. If we talk about artificial intelligence and how we can use that in the health sector. So that is one promising thing. And the second thing is that I really think that Florence Nightingale, at her time, she was a symbol for helping people. And I think this new generation is much more into thinking about sustainability. Also, when it comes to relations to others, that it's very important to help others. And that came through also during the pandemic, that people on the street were really making them like heroes. And I think that and that helped youngsters to become more interested in the health field. And the third thing I want to say is that you are guaranteed a job if you go into the health sector. We are talking about people that are unemployed, but here, no way, you have a job when you are examined. And in Sweden, we try to make the helping nurses to become more professional by giving them a title too, a professional title. It should be some guaranteed examination, and then you can call yourself an assistant nurse. So I think this is the job to take if you want to have a job. And to be practical now to the youngsters, you must tell them, here is the way to a job. And also we have this question in Europe about integration, and we haven't spoken about that, but here is really very many who goes into and work with elderly from other cultures than Swedish, and they do a fantastic job. So also when it comes to integration, I think this is also a very good way of integration, because many of these people coming from other culture has another attitude against elderly, and is much more elderly sometimes love that they come to their homes because they are kind, they show respect for elderly people, something that we have forgotten sometimes in the Western world, where we have cherished the young people. But no, they are much better in handling elderly people. So, well, I'm looking in a light perspective. I see the light in the tunnel, that I think more people will go into the health business.
Thank you. We are very close to our sort of final time. There was one question directly to Mrs. Reiber. Maybe, have you seen that? Because I haven't actually yes, there we go. Final exams in the process of reskilling, upskilling. Maybe you could say one sentence, and then we actually have to come to a close already.
Yes, there are final exams, and for reskilling and upskilling, there are different ways. So you could do it as a second chance education, as it was said before. Or you could do it after the first apprenticeship. There are very different parts of further education to get them specialization for a specific field, for example, for the care of patients with cancer and all that. So you can really choose a specific career and a specific way of education. And that's also a great, factor of attractiveness, that you have so different ways to develop your career, your professional life.
Yeah, thank you. So as I said, unfortunately, we have already reached the end of our exchange here. So ladies, I thank you very much for your insights. I think we've tackled a lot of interesting things. Especially I'll take from the Swedish example, the need for the lifelong learning and the interest of elderly people to become involved, and therefore also then the adult education. I also take from what Karin Reiber said, the necessity to expand the responsibilities of professional nurses, and also that links, I think, to the recognition issue that was mentioned as well. And I also take from the other examples from both Luxembourg as well as from Spain, the need for flexibility and the importance of being really closely linked with other stakeholders in your sector and be flexible and able to react to new needs and pragmatic use of networks of knowledge, etc. So I think there's a lot of different topics we've touched upon, and I would love to go into detail with many more of them, including the digital possibilities and the robots and other topics, but maybe for another workshop then. For the moment, I really would love to thank you all for your insights and your views, and I will give the floor at the very end to Norbert Schöbel from the Commission, DG Employment, who will sort of send us off with some information. Norbert, the screen is yours.
Thank you, Sandra, and thank you for all these very interesting insights. I will not repeat what you just said, but what I learned, starting with Cedefop and very interesting Rubik's Cube, but also I can only invite you to read the latest briefing note on apprenticeship, a pill for every ill, because that's really a very good document. We can send you the link for this. What I learned from Cedefop is that the growth is extremely, let's say, positive, the growth until 2030 by more than 10% in the sector. And now if we come to the examples like Sweden, and we see the differences from Sweden to countries to Cyprus, it's a huge difference among the member states. But at the same time, what I learned from the Swedish and the German contribution is that there is for sure more interest, as in Sweden, in the profession, as we call the heroes. There's a light at the end of the tunnel. And at the same time, quality seems to be very important, which brings us to aspects like the workload, the working time, the wages, as was mentioned by Mrs. Reiber, and but at the end, all this practical experience is extremely important. From Luxembourg and Catalonia, particularly, I learned a lot about the flexibility. I mean, I was surprised in Catalonia that you have so many possibilities to adapt the curricula to your regional needs, but also to the needs of the companies or in the health sector. And also in Luxembourg, many thanks for highlighting the importance of the bridges we need, and also the lifelong learning perspective. From Technica, for sure, very good examples from the Basque Country is to how to make a concrete contribution like these examples we had on producing face masks. I will now just say that this was today one of online meetings we had on the role of cities and regions in related to the European Alliance for Apprenticeship. The first one was on the impact of COVID-19. So it's a bit like a circle, because today, of course, the health sector is the sector which is one of the most affected sectors, like the tourism sector, for instance. And we had one on green and digital skills. And I would just want to tell you that we are now planning a big event, unfortunately also online, on the 3rd and 4th of June, on the role of regions and cities delivering high quality apprenticeship. We do that together in joint cooperation with the Committee of Regions, but also with the German delegation of the within the Committee of Regions, ELO, the Basque Country. So we have many support for this meeting. And we will look into a little bit further into topics which we have not yet discussed, which are important. Today it was mentioned, for instance, migrants integration. We will come back to that. Circular economy was also just mentioned, sustainability, but also cross-border cooperation, smart specialization, the whole aspect of internationalization, vocational education and training, the other learning, and I found it very interesting, the link between the respect also for young people and elderly people. So that's the intergenerational approach is, I think, very important. So I can only highlight, and I repeat myself, that the cities and regions play a very important role for two reasons. They can be a catalyst in the local community or in the regional community. And at the same time, they also are employers in the sectors, and that's why they can play a big role also when it comes to apprenticeship. Now I would like to thank again all the excellent speakers and their insights they shared with us. I would like to thank particularly Sandra for the moderation, and also thank Victoria for hosting us and give us all the support we needed for this event. So stay connected. The next online event will be on the 3rd and 4th of June. So check our European Alliance for Apprenticeship website and our LinkedIn group we have established. Thanks for your attention and have a nice day. Bye-bye.
Thank you all also from me. Have a good afternoon and enjoy.